Why become a certified biological dental hygienist in the midst of a 38-year career? 13 years ago, I left my dental hygiene job in a traditional dental office and opened my own dental hygiene clinic right here in Canada. And from that day forward, I was in complete control of my career and carried all the responsibilities right here on my shoulders. It was critical that I made sure that my patients received the best care possible. Someone told me once that if you were in the smartest person in your circle, then perhaps you need a new circle. And this is exactly how I felt about my career. I had perfected my skills from the knowledge I'd acquired at college as a dental hygienist over the past 3 decades. But one thing for sure, it was never too late. And it was time to begin a new learning journey into a science that fascinated me, holistic and biological care. An amazing dentist colleague of mine introduced me to the IABDM. I had never heard of them before and quickly realized that here there were so many resources available. I knew that I had to be certain that I acquired the proper knowledge to practice as a biological dental hygienist. And science-based learning was the key to providing the education that I needed. I dove into the learning and I attended international conferences and learned from the best scientists and healthcare providers possible. As I was learning, I was beginning to understand some of the negative effects dentistry could have on our whole body health and quickly realized that there was so much more I could do to help my clients in their oral health as well as their overall health. That didn't involve harmful ingredients or chemicals, and that were so much more friendly to the body. The first change I made was to introduce a microscope into my practice, and I began to do plaque analysis. This was fascinating to both myself and my patients, as we were able to actually see the pathogens that were responsible for periodontal disease. If you've ever struggled with getting your patients to comply with their home care routine, wow, just show them a slide under the microscope with all those little moving creatures that are living in their dental plaque. I'm telling you, they can't get home fast enough to floss. The importance of flossing was taught to us in college, but I found myself asking more questions. Is there even a better way or a different way to remove the pathogens successfully besides flossing? I came across the art of oil pulling as an effective remedy to improve gum health and reduce inflammation. It works primarily by decreasing the harmful bacteria in the plaque and in the mouth that contributes to gum disease, especially those Streptococcus mutans that are the key player in plaque buildup. It involves using natural oils such as organic coconut oil to dissolve in the oral biofilm and thus removing those nasty little bacterial pathogens without harming the good bacteria that we need to maintain a healthy oral microbiome. All the patient has to do is swish the oil between your teeth and around the sulci for about 10 minutes at a time until the plaque is dissolved and incorporated into the oil, which then the patient just spits out. Wow, how easy is that? My clients couldn't believe how clean their teeth felt after oil pulling and were happy to get away from those commercial mouthwashes that contain chemicals that could be harmful to them. Another great product that is now on the Canadian market is molecular elemental iodine, which I have recently incorporated into my clinic as a pre-procedural rinse, as well as in my chairside water delivery system. Elemental iodine is safe, effective, natural, and organic. It's an antimicrobial preventative agent, and within 15 seconds of swishing with this product, it effectively reduces bacteria, especially the 6 harmful ones that for periodontal disease. It will also remove viruses and fungi and spores. It's a great product. And given the season that we are in right now in 2020, this product is a game changer for dental offices. Calcium bentonite clay is another great natural mineral that can have a positive effect on periodontal disease. Bentonite clay is a broad-spectrum antimicrobial agent that can change the pH of the oral cavity from acidic to alkaline. Patients with gingivitis can brush with the clay, and patients with mild to severe periodontal disease can make a clay paste and apply it between the teeth and around the sulci that come into contact with the microbes that are attacking the periodontal structures. Gingival massage with ozonated olive oil is also a very effective way of killing bacteria, viruses, and fungi, and is ideal for treating oral infections as well as preventing gingivitis and its progression into periodontitis. When it comes to oral health as it relates to overall health, as a biological dental hygienist, I spend time going over the fundamentals of basics such as diet, sleep, importance of vitamin D levels, toxic exposure, pH levels, as well as environmental and emotional stressors. All of these things have an effect on the immune system. My progression into biological dental hygiene has been an incredible transformation of my career. I have come a long way in my knowledge base from what I was first taught in school. My clients are always very grateful to gain more insight so that they can make informed decisions about their oral health. As an oral health practitioner, I would encourage all of my colleagues to reach for more. If you're watching this video because you're interested in becoming a certified biological dental hygienist, then you are in the right place. Reach out to the IABDM for direction and start your learning journey just like I did. Remember, you're not defined by what you've done. You are defined by what you're going to do next. Thanks for listening, everyone.